Good evening, everyone. It's Monday, and oh no, it isn't Monday anymore. I was thinking it's Tuesday, and we're doing Tuesday testimonials, and we have a wonderful guest speaker, Dr. Thomas Acklin. This is going to be an excellent call. So glad you could make it, everybody. People are still pouring in. That's what we like to see. So the first 15 minutes of this call are going to be testimonials, sort of like our miracle call, which is Monday morning. So all you need to do is, if you have a testimonial that you'd like to share, and oh, by the way, we'd like you to keep it really brief, really compliant, and then be done, say in 30 to 60 seconds. So, and the first part, we're going to just go ahead and talk about X39, okay? If you have other patches you'd like to talk about, let's give that a break, and we'll come back to those later, if at all. And then about 15 minutes into it, we'll introduce Dr. Acklin, and you can put your questions to him in our chat. So get ready to do that, but don't do it right now, because then I'll lose it. And I need to be able to see the chat and your questions about quarter after the hour, okay? Okay, right now, Liz, I can't even see the chat. I'm trying to figure out how to get it. I know you can help me. So let's just get started. Who has a testimonial they would like to tell us? And raise your hand so I can see you. If I can't see you, I'm going to ask Liz to help me with that too. Don't see any hands yet. If you guys don't raise your hands, you know you're going to hear my smell story. Hey, Liz.
Yes, ma'am.
See any hands up?
No, I do not.
Okay, well, I've been doing the LifeWave patch thing now for 3 years. I've had lots of results. I had a result within 2 days. I've had lots in between, but the one I love to talk about the most is this one. So guess what? I was born without the sense of smell, no olfactory sense. And I never thought I'd have a sense of smell, but guess what? I was a really good girl, and I was consistent wearing my X39 every day. And so 2 years go by, and I'm out in my backyard and I'm weeding, and I have a weed in my left hand and one in my right hand. And I'm putting them in this little bag over here, and I'm weeding, and I go, huh, this weed smells different than this weed. Wait, what? Yeah. So what's the key here? Consistency, you guys. Don't ever give up. And even if you think it's, quote, not working, just don't give up, okay? Really important. So thank you, Christina. Let's have you come on in.
Okay, I'm here. Well, I thought I would share my mom's story. I've shared it a few times. She's been on the patches for 2 years, and her it was her first finger at 2 years old, it got shut in a door and it got bent. And so it grew off to the side. And it's been that way her whole life. I mean, it's always been bent. As kids have known, that her finger's been bent. And she'd point, and my dad would tease and kind of move her hand over. You mean over there?
Yeah.
And she's been on the patches 2 years, and she heard Robin tell her story about her finger being bent, and it, went straight. And Mom looked down at her finger, and she's like, just freaked out. Christina! I come running upstairs, and she's like, look at that finger. And it's completely straight.
Aw, that is very similar to Robin's story, isn't it? Yeah. Oh, we love to hear that one. That's a good one, Christine.
Thank you.
All righty. So we have Kate Morris next, please.
Well, good evening, everybody. I have the pleasure of telling a story of two chambers of my heart. There were two heartbeat affecting situations, and they both start with A-F. And I had them for years, and they were very scary. And the threats of other things that could happen were heightened during that time. And then they started making me faint all the time, anywhere it would, and that was making it even scarier. And I want you to know that because of X39 plus its sister patch, the X49, I no longer have those in my heart, in my body, in my life. I'm no longer afraid, and I'm not afraid of the other things at the other level, and I'm not passing out all over the place. Life is so much better.
Thank you so much, Kate. We're so glad that you're here and that you do share that story. It's very, very inspiring. I'll see you soon over in Orlando, right?
Yes, definitely. I've been in Florida since the 4th.
Wow, fun. Okay, let's move on. I see Ravel is here with us. Go for it, Ravel.
Thanks, Sunshine Rose, for stepping up to the plate again this evening. It's a pleasure to see everybody. I just wanted to share a really interesting experience by Mr. Henry Chamberlain. He gave me the permission to share his testimonial, and he's on with us tonight. He's from Arkansas. He and his wife are celebrating their 60th anniversary this coming week in a couple of days. Anyway, he's been on X39 for 7 days, and usually he'll get fatigued after about 5 minutes of standing up, and that's not happening anymore. And one of his neighbors was remarking that he was quite busy. Like, for example, today he was working from 10 o'clock until 4 p.m. and he has not been, mowing yards and keeping quite active. And if I mentioned his age, you'd say, wow, that's great. Anyway, he's feeling more energy, and it's nice in the first week already. That's it.
Wow, how old is this man?
I'm just checking my phone to see if it's okay with him. I did kind of allude to it. 83. Yeah,
Wow.
83 young. Yeah.
Isn't that cool? We don't have to be a certain age or anything about our stem cell patches. It's just crazy good. And we really thank you for showing up too today, Ravel, and supporting us in this great time just before the convention. I'm actually at a hotel in Phoenix, Arizona right now. So doing our best, aren't we? And thank you so much again, Ravel. I see, let's see, Kate's hand is still up. Were you going to say something else too, Kate?
No, I just forgot. Pardon me.
Okay.
I'll get it down.
Okay, everybody in the peanut gallery, let's get on it. Let's get sharing some of our great stories. That's the only way this whole company works, is by wonderful stories that are shared. And then we share our patches, and all kinds of things seem to happen to bring the body back to balance with itself.
Hey, Sunshine, I'll jump in real quick a bit early, since I was very inspired by Christina's Mama's Fingers story.
Okay.
And a lot of you have heard this before, but when I was a teenager, I came into second base and dove over the second baseman, landed on my hands, left elbow bent in, shattered the radial cap, had a series of fractures, a series of operations and whatnot. Very successful, but pin insertions, and it took a little bit. And my left arm had never been quite perfectly straight. I noticed after about a year of X39 that a lot of my scars were shifting. And I also noticed that my yoga practice, I have a very strong yoga practice, and I noticed that my shoulder girdle was different. My posture was different, and I had to recalibrate. And today my left arm is almost straight. It's fantastic. The body goes to work at the stuff that it needs to go to work for, but after it's taken care of the emergencies, then a lot of those structural things begin to repair as well. Very exciting.
You're muted, hon.
Thank you, doctor. Thank you. I was saying, muted, that, you know, those of us that have been around the block with LifeWave for 1, 2, 3 years, we're the ones that see these changes over time. So you've got to be patient, you know, the body might have been in its condition for some time, so it might not happen instantly, but it will happen because our body is our own resource, according to David Schmidt. All righty, I see Michelle's hand is up. Thank you, Michelle, please.
Hi, Sun Shower. Thank you for taking this call on from the hotel in Phoenix. You're such a wonderful leader. I have two one thumb and one finger story, keeping with that theme. So you guys, some of you have heard this story, but a couple of years ago, I had been using the X39 for probably about a year, maybe 2. And I put my hand in the trash can to push down the trash that was just kind of full. And it looked like it was just fluffy stuff. And I had no idea there was a broken ceramic plate in there. And I pushed down and I withdrew in a scream, and just blood was just gushing from my middle finger. The pain was like a 20 out of 10. It was just excruciating. And I told my boyfriend to take me to the ER. I said, I just knew this was serious. This was not something we could just, like put a Band-Aid on. So I had the presence of mind to grab another X39 patch. I had one on the back of my neck, but I just grabbed another one and I put it on the outside of a thick paper towel. My finger, I had to wrap it because the blood, it was just gushing. And I put the X39 it was probably about a good inch, maybe 1.5 inches away. But as we know, the patch does not have to be touching the skin, touching the body, because it works on light. Within, no kidding, probably a minute, the pain went from, definitely a 10 out of 10 to about a 7, where I could at least speak. And I said to my boyfriend, oh my gosh, I can't believe it. It still hurts, but it's like I have my mind back. I can talk, this is amazing. We got to the ER and the doctor looked at it and said, there's nothing to sew. We can't even sew it because you actually cut off a tip of your finger. And she said, it's going to be deformed and, it's just you're not going to have feeling there, etc. Well, she didn't know what I had in my little toolbox. So I used Ice Wave. I had one pain medicine in the ER because of what she had to do. And that was pretty bad. But after that, I took no pain medicine. I used Ice Wave and X39. That's it. And I used X39 every day, right on the bandage. And I went back for a checkup like about 10 days later. It was so well healed. And I was able to go back to doing massage, which I do. And about 2 weeks later, there was like, I don't know if you can see, but there was like no sign. It's my middle finger here. I don't want to hold that up. But anyway, the middle finger, and it's like, it's not deformed. It filled in. I have feeling, and there's just a little tiny scar, but that's one story. And then this is a quicker one. I slammed my thumb in the door and it looked like I was going to lose my nail. It got black and blue. And a friend said, everyone said, you're going to lose your nail. And I just kept using the patch. And it took about a month, maybe 2 months, and it grew out and my nail's perfectly fine. It's not deformed, nothing. And it was black and blue and it was a little funky looking for about a month, but it's completely fine. X39.
Did you put the X39 right on the injury?
Yes. Mm-hmm. And I had to use tape, a little bit of medical tape, because it doesn't stick to a nail very well. But yeah, I put it right on. Mm-hmm.
Thank you, Michelle.
Yeah, you're welcome.
Hand stories. Let's see. Michelle's hand is still up. Is there anybody else before we move into talking with Dr. Acklin, our guest speaker tonight? So guess what, Liz? I can't see the chat. Well, let me see. Maybe I can. Oh, there we go. So this would be a time to start putting in your questions to Dr. Acklin. And then when it comes time, I'll call on, I'll read the question and see if doctor can answer it for you. In the meantime, I would love to introduce you to him if you don't already know him. This is a man that's spent 20 years at the Georgetown Neurology as a specialist and more fully stepping into functional medicine, practitioner and food as medicine with gut, brain, and now in recent years, frequency medicine. Well, if you can make heads or tails out of that, I'd love you to say a little bit more about that, Dr. Acklin. Would you do that for us?
You want me to make heads and tails over my career path? I'll tell you one of my favorite things to say out loud, and you can take it with a grain of salt. Is well, I do a lot of gut brain, so we talk a lot in this community about cognitive health, and we'll probably talk about that tonight. I'd love to touch on that because it's a big issue for everybody, whether it touches you personally. It certainly touches almost everybody's family, and if it's not touching your family, I just spent 2 days on the road. It's certainly touching the other participants in our lives, right? So it's we're being slaughtered with some interesting novel assaults this past couple of years. As an undergrad, I actually was very interested in neural mechanisms. So a lot of the reasons I got into gut brain and food as medicine in recent years is because I was so interested in the biochemistry of the neurotransmitters as an undergrad. This is going to be relevant. This is not superfluous information. We're going to talk about the shift from chemistry to frequency. And a lot of science is moving that way. But 40 years ago, as an undergrad, I was quite interested in, wow, you can do something to the body and it shifts the chemicals in the brain that help the brain understand things and help the brain express and help the brain have a particular mood, etc. Go to sleep, fill in the blank, whatever you want your brain to do. I really thought I was going to be a psychiatrist because I was starting down that path. I got tricked into neurology. I was an MS specialist at Georgetown for 20 years after my residency there. And then I also got tricked into buying a yoga studio about 15 years ago in the Northern Virginia metro, which turned into 2 others, and started training as a yoga teacher, learning other of these energy medicine practices and therapeutics. And I'm with the Center for Mind Body Medicine at Georgetown Medical Center as well. And if you guys don't know the Center for Mind Body Medicine, Jim Gordon was really a pioneer. He was the first guy to put a mind body center in a major medical center back in the 70s. Started at Harvard, and then he came down to Georgetown and put this center together. And again, the reason I mention him is we have such groundbreaking thinkers. We are so lucky to be surrounded by such groundbreaking thinkers. And a lot of times we don't know it, for 10 years. You're real lucky when you step into a room with David Schmidt, who is the founder and the genius inventor who's been doing this his whole life. And, 25 years ago, perfected a technique where you could actually do what I was talking about, shift things in the body without actually putting anything in the body, right? So we talk about phototherapy and frequency medicine and putting the body in these convalescent frequencies. And then all of a sudden we hear these great stories that we've been hearing tonight. So you never know. 3 years ago, I started working in food as medicine about 15 years ago. And I worked with other nutritional and supplement protocols and whatnot. And then about 4 years ago, Ann Morrow called me and she said, you got to take a look at this. If it hadn't been her that year, I would have been a no. But thank God people we love reach out to us. Yeah. And I highly respected her, both as a friend and a colleague. And I took a look and thank God, and then I stepped in and I found all the different ways we heal. And by the way, you don't need to maim or injure or torture yourself, or we heard some great stories at the first quarter of the hour about how we come back from injury, but really healthy people do very well on these technologies as well.
There's a good point. Yeah, we just get stronger. We have like 13 different patches, one of which is directed for muscle strength and stamina and bone density help. I mean, wow, we've got it all. You really don't have to go shopping anywhere else, do you? So, well, thank you so much for giving us some of your background, because I love to hear it every time. I just can't remember it all. You've been a busy guy.
Oh, that's just the tip of the iceberg. That's the other thing that happens with these technologies is every single one of us has so many different chapters in our lives, right? And then we step into a place where the current life we're living feels easier, feels better. And a lot of that cognitive space opens up. A lot of what we had left undone in previous chapters shows back up. We have both the physical stamina and the emotional stamina to take care of things that we had kind of said, no, I have to live my life this way. You put the body back into a place where it's got full capacity, and X39 does that, right? It doesn't take off the table the need to make a lot of the other lifestyle changes that we talk about when we're talking about living a very clean diet, living clean air, living clean ideology with great ideas around you, and choosing the people who are around you consciously. But it does confer a certain competence, and a lot of what we talk about with the hormone balance and the physiologic flexibility, the metabolic flexibility that comes along with having a healthy body, then all of a sudden you've got emotional space to take on those things.
It's very interesting. People have been telling me, even lately, Sunshine, you seem so calm. And that's true. I mean, I'm my mother's daughter, and she had nerve type issues and nervous breakdowns and all that stuff. And I think I was prone, genetically to go that direction. I'm not even close to that anymore. So you're absolutely right. Things happen within us that we can't even possibly predict. I'm definitely trimmer than I was. And guess what? My hair continues to get darker and darker. I don't know, my skin's pretty good for 74, What do you think? So I'm guessing we should probably move on and take some questions if you're up for that, Doc.
Please.
Okay. So we have Annabelle. She goes, I have a friend with a genetic condition, muscle weakening. What protocol do you recommend?
I also like to suggest to people that if you didn't come out of mama with it, it's not a disease, it's a condition. And very exciting quantum leaps in our understanding of epigenetics in the past quarter century or so. And a lot of what the doc says, hey, this is genetic, actually doesn't mean that you have to suffer from it. So if it's the one where we see kids curled up, I'll tell you another aside. Actually was at another frequency medicine summit last weekend. And the practitioner there showed a 19-year-old cerebral palsy patient. Okay, I can say that because we're not talking about our technologies right now. This was a different practitioner, and everybody knows what they look like, right? 19 years old, hadn't borne weight in 10 years. Within 72 hours of using these particular technologies that he uses, he unfolded in the first 24 hours, the young man. Within 72 hours, not unassisted, but had his feet on the ground and bearing weight with assistance for the first time in 10 years. I say that because if it's that condition, then yes, it's almost 100% genetic, but there again is instruction that we can intervene with anything. So all that said, X39 is our go-to. A lot of folks can't handle it right off because it's very powerful. And one of my favorite things to do, especially with neurological patients and very compromised metabolic patients, if you're on multiple medications, et cetera, a lot of times people will have what we call a retracing effect, a negative effect. And I love to put the body in autonomic balance with our Eon patch, AEON, Eon. And that's great for the nervous system. And also the sister stem cell patch, X49, is fantastic for brain health. 49 is wonderful for the more mature tissues. It's a great instigator for 39. Upregulates a different copper peptide, but it's fantastic for bone and brain and muscle, not the least of which is heart. Yeah. So I don't know if that pointed to the question enough, but a lot of what we're offering here is lifestyle shift. We have incredible interventional technologies, which are obviously impactful. But as the body wakes up, you start to do more to shift into the regenerative medicine side of things, where those 500 billion cells that we're making every 24 hours actually can be better than the ones that we made yesterday. Yeah.
Okay, thank you so much. I think we
Sure
might
thing.
jump on. I know Annette had a second question, but we have so many folks asking. Here is a person that's on an iPhone saying, someone with a serious neurological problem has had trouble with bowel elimination and found a medication that was working. When she started the X39, the bowel elimination problem resumed, even with her first surgery medication. Is there a patch protocol that would help that with that process?
Well, the best protocol is consistency, right? So you definitely want to work with the folks who brought you, work very closely and stay consistent. As I mentioned, Eon is a nice first start, but X39, and we like to say, for however many decades old you are, use that number of months as your promise to yourself. That's the number of days that I'm going to wear X39. That's the number of months that I'm going to wear X39. And almost every day, we wear 12 hours on, 12 hours off. And again, some people can't handle that 12 hours right away. So you don't have to wear it for 12 hours. But if it's 12 hours on, 12 hours off, you can do that 7 days a week. If you happen to leave it on and forget, just leave it off for 12 hours before you put that same technology back on. And then we also, this is getting a little complicated, and I know you wanted to keep it Sunshower to just X39, but we do have other protocols, not the least of which is a beautiful little offering called the HAT protocol. And one of our 2-patch technologies called Energy Enhancer, which is the very first technology that David developed back about 20 years ago. And it's a 2-patch system, and you can think of it as the ends of a battery, right? The nodes of a battery. So you put one set here, and you put one set front back, and you put that Eon patch that I mentioned that's so great for brain and autonomic stabilization. And sometimes a glutathione even, which helps the drainage. And the drainage in the brain is dependent on the drainage in the rest of the body. It's interesting that the first benefit she saw was motility, the way the gut moves. And so obviously she got that's a parasympathetic, by the way. That's a rest and relax. When you're in fight or flight mode, the gut doesn't move. So anybody who's in chronic stress and chronic parasympathetic tone, the body says, no, we don't have time to digest things right now. We got to get the hell away from the tiger, right? So that's first order of business, is stress management. But since X39 was her first order of business, once you've got that motility in order, you've also got lymphatic drainage in the body, because those 500 billion cells I mentioned that we make every 24 hours, we also have to release 500 billion. And if your body's not, call it metabolically courageous enough to let go, right? If it's still holding on tight, then our lymphatic drainage doesn't have integrity. And there's a little known, a lesser known, I should say, component of the lymphatic called the glymphatic, which is the brain's lymphatic drainage, just the brain's release of the dead stuff And people say, well, they taught us in med school that once a neuron dies, it dies. So why is there dead stuff in the brain if it's dying? Well, guess what? You can regenerate every tissue in the body. We regenerate, as we heard from some of the stories, and we see that. So it's consistency. But I would go 39-49. We call it the performance bundle for a reason, and then you can fine tune and tweak along the way.
Excellent. Well, guess what? We have like 10 other questions and we have like 4 minutes. So I'm going to throw out some hopefully quickie questions and quickie answers from you. Would that work?
Sure.
Okay. Toenail fungus.
Get thee to the ocean. Maybe that's why I was choosing this background. Get your feet on the ground. Stop wearing shoes. Stop wearing socks. Grounding is probably, we have artificial, beautiful interventional technologies that look like this, but Mama Gaia's got the best interventional technology. And to the extent that we can keep ourselves barefoot and in the electromagnetic fields and frequencies of Mother Earth, we're doing great.
Okay. Vaginal dryness.
Well, again, we're looking to bring total body fluids back up, right? So a lot of, and when all of these technologies, it's a very good idea, strongly recommended that we stay incredibly well hydrated, because all of a sudden tissues that haven't received the proper applause metabolically for many years, right? That chronic inflammation, that loosens up. And so we want to be hydrated to bring the repair steroids to the area. So as far as a hormonal shift, we do have one of my favorite patches is called SP6. We market it for cravings. It's beautiful for the entire hormone balance of the body from the hypothalamic pituitary axis down. And women who go through change of life love the combo of 39-49 and SP6. Again, with a lot of the lifestyle changes that go along with it. And if you want some topical relief, this doesn't change the underlying condition, but I have worked with folks, and I saw a question about prostate. We worked with several prostate similar. You can put put your fingers on the bony parts of the front of your pelvis. You can put Ice Wave and or energy enhancer on the front, what's called ASIS, anterior superior iliac spine of the pelvis, and an Eon patch or an X39 right at the perineum. So right behind the scrotum, right behind the vaginal. And that creates a nice little triangle. And sometimes that creates some very nice symptomatic traction. Again, it doesn't change the underlying, but it focuses on the target, on the tissue at hand, on the organs at hand.
Very good. Righty. Let's see. I'm jumping around a little bit, but before I do even ask another question of you, I'm sure folks that aren't getting their questions answered would love to. Is there a way people can just reach out to you and get some of your wisdom?
Well, I will put my contact information in the chat here. And we have plenty of places to come and say hello. We're lucky with a very large team of lots of folks who speak these languages. But yes, please feel free to reach out.
Okay, when someone starts with X39 and has severe headache response, is it better to use Eon 2 or just Eon? Already shared about hydration and electrolytes.
Right. Again, it depends on the person, and it's an experiment. There's no right or wrong way to do these. That's why we call it bio-individualized, and work very closely with the person who brought you. There's no better or worse. Everybody's different. Everybody's got a different metabolic fingerprint and profile, and that's why it's so interesting to tell the stories, right? And to pay very close attention. That's the other great thing to do is keep a journal and suggest to folks that you're working with, keep a journal of what they're wearing when and how their life went that day. And it doesn't have to be complicated, but it's a great way for people to look back and realize that a lot of the things that they do with their life now actually start impacting, right? So a lot of what we are looking for in well-being is not the what to add, it's the what to let go of. And those what to let go of things actually start yelling a little bit louder once you've put the body in proper position. So you wear X39 for 30 days, and sometimes you realize you don't want that, fill in the blank, whatever it is that's tormenting you.
Exactly. Well, I know if Robin were here, she would have asked you at the very beginning, so what made you decide to embrace the LifeWave technologies? But basically, you've answered that question many times over. Is there a specific answer you have?
Sure, to bring it all full circle, when I was talking about my particular path, it's very interesting now as we break free from the biochemistry conversation. It's not that it's not important. We still want to talk about the molecular impact of your vitamin D and your vitamin K and what's the ascorbic acid and what are the antioxidants and whatnot. But we're now understanding that they also have a personality. Anybody who's studied water now is seeing all the subtleties with the various structured waters and the frequency infused waters. We even have an age reversal system. We have aromatherapies that are inside a pretty elegantly crafted, what David calls age reversal water delivery. But I think we're going to see a lot of that. And that's what's exciting here. And I can't wait to see what David's going to unfold here at convention this weekend. I have a feeling it's going to be something in that flavor of the conversation is we're going to look back on, what we've been doing in medicine for the past 50 years with biochemical interaction. And we didn't know better, right? But now all of a sudden we've got this beautiful panorama of brand new technologies that are opening up different kinds of manipulations. And again, it's not like allopathic medicine wants to go from the outside in. How do I fix you? Nope. We get to put you in a place where, and it's not even us putting, you choose to step in, right? And then you put yourself in a place where the choices that you make with your life actually have impact. People find that their supplements work better, their good food choices work better, et cetera, et cetera. So I think we're in for a fun ride this week. We're going to be having a very interesting adjunct conversation next week after we do our dance.
Yeah. Yes, indeed. All right. Well, thank you so much for joining us as always. We really, really appreciate the depth of what you say and the insights. I know that people will probably taking notes like crazy. And who knows, they might even get to meet you and ask their question in person in a couple of days. So
Look forward to everybody.
Pardon?
Thank you for hosting Sunshower, and thank you everybody for being here tonight and bringing great stories, great energies, and for who you are out there on the planet.
As you always
Thank
say,
you.
we are bright lights.
Thank you very much, Dr. Acklin.
Good night, all. Thank you.
Thank you.
See you soon.
See you
Yeah.
soon. Thanks, Sunshine.
Thank
Thanks,
you.
Dr.
Thanks, everybody.
Thank you, Dr. Acklin.
Thank you.
Appreciate
Good
you.
travels.
Thank you, Dr. Tom.
Thank you.